So we're here with Dr. Nancy Williams again, who is our public health officer here for El Dorado County. Hi, Nancy. How's it going?
I'm doing great. How are you?
Not too bad. So California's starting to open up again. We've gone into phase 2, right?
Mm-hmm.
So
Yeah.
so what does that look like for El Dorado County?
So as last Friday, we were able to submit, I guess late in the evening, our my attestation, which said that, in my professional opinion, El Dorado County was ready to move into phase 2. And not just to move into phase 2, but also to move into phase 2 with a little bit of an accelerated schedule compared to some of the other counties or the state as a whole. And that was because we had low numbers of cases, we had no deaths, we have adequate testing capacity in the county now, and we have adequate contact tracing and other preventive measures in place that put us in a good position. So we got that reviewed over the weekend, and it was posted on the CDPH website, I think on Tuesday. Is that right?
Yeah, I think so. 2 days ago.
Yes.
Mm-hmm.
So that made it official, and we've now directed our businesses that are eligible for starting in the phase 2 categories that they can begin operation again once they have gotten the guidelines off the California Department of Public Health's website and gotten their business plans together so that they are able to operate safely, and then off they go.
Awesome. Now, can you kind of fill us in on what type of businesses we should be seeing starting to open up here?
So the best place to go for a complete list would be the state's, I think it's called the Resilience Roadmap website, and that has a list of the businesses on it. I'm not going to probably do it justice if I try to name all of them, but a lot of them are various forms of retail and types of activities that are relatively low risk for contact, so where people can stay 6 feet apart fairly easily and not have person-to-person contact that would be risky. The notable exception that is now allowed in El Dorado, and I believe at least 6 other counties in the accelerated version, is dine-in restaurants. So that's not allowed yet across the whole state, but it is allowed in our county.
Awesome. That's really good to hear. I'm sure a lot of restaurants are really excited now.
Yes.
Now, what are kind of some of the guidelines that businesses need to be following, specifically our restaurants, just to give people peace of mind that if they do decide to go out to eat, they know that it's going to be a safe environment for them.
Right. So, of course, the general public is able to go to the state's website, this Resilience Roadmap website, and look up these guidelines. They're all publicly available, so they can know what they should expect to see and be able to see, is this restaurant that I'm going to meeting the guidelines that I see in writing here? And those are, a lot of them are very common sense, of course. It's the things we've been hearing since the very beginning, which is the keeping the distance. There's a recommendation from the state for face coverings. I do not have a mandate for our county at this point for face coverings. So while it is a recommendation, again, across the state, when people are in public and have to, especially if they're in positions like in retail stores or out in recreating or anywhere else, if they're going to be passing people at less than 6 foot distances, it's just one extra way to protect. But the 6 foot distancing, sanitation, of course, being the key thing, the number one thing in all situations that I'm really going to continue to emphasize every chance I get is staying home when you're sick. So that is the most important thing that anybody can do. So by staying home, you can protect your fellow residents in the county. You can protect businesses. We don't want businesses to have outbreaks because that puts them at risk of staying open. It also potentially puts the whole county at risk. One of the things that I had to attest to was that we had a plan for having to roll back, if we had to roll back the restrictions to be tighter again based on things that we're seeing about illness, then we would do that. I'm hoping we don't have to do that, and I really will rely on our residents and our businesses to be safe and, again, stay home when sick and stay away from other people. And we want people to get tested now. The testing is very available. So getting tested right away anytime somebody has symptoms is really important so that people know when to stay away and protect other people.
Yeah. So I want to circle back to testing, but first I want to ask too, is there any businesses that aren't on that approved list that you were kind of surprised that, oh, like why isn't our state government saying that that's okay?
Well, I wouldn't say I'm really surprised. I think the biggest thing that adds a lot of questions still is that not every specific activity is listed, and so there are some activities that are probably rare, or businesses that are not very common that are not specifically listed, and some of those people are in positions where they feel that they may be able to, or they're likely to be able to, keep the proper distancing and sanitation and the general requirements that everybody is going to have to follow. They're wondering, are they allowed to operate?
Yeah.
Is there somewhere this is in writing? And unfortunately, the government is not probably ever going to be able to put out a list that's that complete. There is a way to contact the California State Department of Public Health and find out, to put an inquiry in and ask, is my business okay? But at this point, I would say the ones that appear to be more risky are more likely to be waiting until stage 3. And that includes, I know a lot of people are very eager to get things like salons and barbershops going again. But again, those require close proximity work between clients and business operators. And so the state's not comfortable yet doing that. So that's one. I wouldn't say it surprises me that it's in stage 3. I think the governor's been saying all along that some of those things are going to stay on stage 3. And so that's not a surprise. Other than that, I think mostly it's just a matter of getting some more clarification over time with some of those very specific businesses that need to figure out if they're okay to operate or not.
Okay. Now, back to that thing of testing. So one of those things that allow us to, start opening up going into phase 2, you said we had, good testing, facilities set up and everything like that. Can you kind of fill us in on what El Dorado County's procedure is right now for testing?
Right. So people have probably heard that in order for the governor to be ready for the state to move into phase 2, they wanted to have enough testing statewide for accommodating people should we have an uptick in cases. And so they contracted with this company to put up these testing sites in numerous counties. I believe there were 80 of them, and I think there were 6 more added. So 86 new test sites. El Dorado County got 2 of them. The company that's running them is called OptumServe. And they each can handle up to 132 tests per day. One of them is located in South Lake Tahoe at the community college, and the other one is located on our western slope at Ponderosa High School in Shingle Springs. And again, 132 tests per day. That is probably between 4 and 5 times as many as tests per day as we were performing prior to that time with all the other sources of testing. So it really, really increased the amount of testing that could be done in the county. There's probably not a huge need for that much testing to happen right now, but the capacity is really important in case we do have more symptoms popping up. We want to make sure people can get in right away.
Now, just remind us, what is the purpose of that testing?
Yeah, it is a test that tests for active infection right now. So it's looking for the actual virus present in the person's nasal and it's the oropharynx is actually where it's taken from. So it's a swab that goes in through the nose and collects some fluids from there, and then they check and see if there's any virus in it. And it's not an antibody test, which is the test that you would do to find out if you had immunity to the illness, which would mean you had been infected sometime before that. So it really is, it's a point in time kind of test. You do it today. It tells you if you have an active infection, even if you're not sick necessarily. You may not have symptoms, but it'll tell you if you're carrying the virus around today. And it won't tell you anything about tomorrow or what happened a month ago. So that's really what's the reason we're looking to do it, is so we can pick up people's active infections, and people who are carrying the virus around, let them know that they need to be away from other people for a while.
Okay. Yeah, that's definitely good to know that this isn't a, did I already have it type test. It's a, do I actively have coronavirus right now? And then also, I'm sure a lot of parents are wondering about schools. Like when do we think we'll get to send our kids back to school?
Right. So schools are listed as a stage 2 activity. There are no guidelines posted yet, so that means they're not able to start yet. I believe the California Department of Education is working closely with the California Department of Public Health on the state level to come up with some of those guidelines. Locally, I've been working with our county Office of Education superintendent, and we've been talking about what school may look like for them in the future. And of course, they understand there that we're waiting for guidelines and we'll have to follow those. I believe they've made the decision that they won't pursue summer school at this time just because they're expecting that there's going to be a lot of change needed for the fall, and they want to be completely prepared for the fall and not distracted in the meantime. And their distance learning apparently is working pretty well, so they feel very comfortable continuing with that for the time being. And as soon as the guidelines come out, they will continue their preparations for getting started again in the fall.
Okay. So when do you think we'll start to see some of those guidelines from them starting to roll out?
Well, I would say any time. I think everybody recognizes it could take many, probably weeks to months to really get the school things set up in advance. I'm sure schools are going to look very different. I think there will be a lot more spacing, changes of activities, changes of schedules. Some of the ideas that have been bantered about include things like staggered classes so that students come in at different times during the day and that sort of thing. So a lot of those things I know are being discussed, not necessarily so much at the local level, but at the state level, and information is trickling back down to us. But I'm not sure what it looks like yet, but I expect school is going to look very, very different.
Yeah, definitely. Is there anything else that you want to add before we close out here?
I think really the main thing that I want to continue to emphasize is just to let everybody know that at this point we've gotten a lot more freedom to operate businesses, to do a little more activity. There still is a statewide ban on non-essential travel that we are still encouraging people to follow. I think the number one important thing, though, is stay home when you're sick. Go get tested as soon as you have symptoms. Even if you aren't sure if it's COVID, it's easy to do right now. Even people without funding without insurance can go to these test sites and get tested. You have to make an appointment first, but it's really easy to do either by phone or on their website. And our county website has information. You can just click on the COVID link from our main webpage, which is edc.gov.us, and there's information on the COVID page about testing. So people can go there and get signed up within a short period of time at either of the two sites.
Yeah.
Or they from their regular doctors, or their regular physicians or providers' offices as well.
Okay. Awesome. Yeah. And I just want to add too, like, you guys have done a great job with the website and all the info on there. And, if anybody's wondering about how many cases that we have, you guys have really done a good job. Like, there's good graphical info on there and everything. And actually, just real quick, where are we at with cases? I know you were saying that we haven't had any deaths, which is awesome, and we're still pretty low.
Yeah, I think when I looked earlier today, and I'm not sure that was before or after the time, the day when we changed it, but it said 62. Okay. So 62 cases so far in the county. Okay,
awesome. And do you know how many recoveries that we've had so far?
I didn't look at that today, but I think most recently it's been running about 10 fewer than the total number. So maybe we've had about 10 active cases ongoing for a while or less.
Okay.
Yeah.
Great. All right. Well, sounds like a lot of good news for El Dorado County. I'm sure a lot of businesses are happy start to get to open up and everything. And thank you so much for coming on, Nancy. We really appreciate it.
All right. Thank you so much for having me.
All right. Thank you for tuning in, everybody. This has been an episode of Liberty and EDC here with Dr. Nancy Williams about the COVID-19 situation here in El Dorado County, giving us a quick update. And we'll see you guys next time.
Do you need excavating and trenching? All Good can handle it. Do you need brush and land clearing? All Good can handle it. Locally owned and operated for over 40 years, you'll be in good hands. For all your excavating and demo needs, give us a call. 530-344-3417. 530-344-3417.